Belly fat, gaining weight, feeling tired. No, it's not in your head. These are all signs of your metabolism shifting. But here's the frustrating part. When you usually go to get help, you often hear that it's calories in versus calories out. And that's simply not true. There are so many facets to our metabolic health. Everything from understanding what your gut's doing, where's inflammation, where's your overall hormone balance, are you getting the nutrients you need, and what in the world does the liver up to? And why is that important? Because the liver is responsible for blood sugar and insulin regulation. Most of the time, a conversation around metabolism doesn't address any of this and really just talks about diet and exercise. But we have to go deeper because so many of you are working harder, eating less, and not seeing results. In this next webinar, we're going to dive into all things metabolic health, help you understand the patterns that you should be aware of, and where to begin a journey to losing weight and shifting your metabolism in the right place. I thought it was an opportunity to break this topic down. And yes, the first slide says exactly what we all hear over and over again, that your metabolism is all calories in versus calories out. And we all know simply that that's just not true. So if you're being told that, I want you to dump that belief and thought in the trash, because that actually creates a lot of the negative association and negative relationship with food. Okay, so if hopefully you're ready to move on, let's jump into the next slide. Jennifer's helping me here, by the way. Hopefully one day if we do in-person stuff, you'll actually get to meet her. But we're going to start with a basic definition of metabolism. Now remember, there's so many ways. People think it's about energy, which it is. They think it's about their weight, which it's really not. But metabolism, if I pull it right out of the dictionary, it's a chemical reaction that changes what we eat, our food, into energy. And we need that energy for everything, from how we move, to how we think, to how we grow. And there are all these different chemical reactions that are involved in determining what your metabolism is. Lately, researchers are calling this the concept of metabolic thriftiness, meaning how capable is your body to adapt to different changes in body and body chemistry to adapt your metabolism in the right direction. Some people, genetically or otherwise, are able to do it really easily. Others have a really tough time. They have less metabolic thriftiness, which is what makes weight loss or changes in their body chemistry very difficult. So I'm setting that out there because it's first important, and this marries a Chinese medicine concept of qi. It's very important to first understand who you are and to accept that before you keep comparing yourself to everybody else, and understand that you may have a different level of metabolic thriftiness, just like you might have a different level of energy than your neighbor or your counterpart does. In Chinese and Eastern medicine, you build a life around these ideas. You don't run a life and then expect your body and your chemistry to keep up. So hopefully that's helpful. Let's move over to the next slide. So what is your metabolic engine? Okay, so here's the real definition of metabolism. Metabolism is about converting food into fuel and energy, but none of that can happen, even if you're eating the cleanest, most perfect food, unless all of these things that you see on the screen here are in the right place, doing the work that they're supposed to do. So the gut, if you wanted one thing to remember, the gut is the core engine, the center of your metabolic health. And we're going to break down the gut concepts in just a moment. After that, I would probably layer hormones as the next important component of metabolic health. All the hormones, and there are hundreds of hormones, not just the ones that you think about all the time. Your nutrient capacity, really important, and moving energy, converting energy from point A to point B. Inflammation, so many of you come to me and you want to lose weight or you want to have a change overall, but you're inflamed, right? You have like chronic inflammation and you're starving yourselves or you're working out super hard and you're not seeing things change. Well, until we bring that inflammation down, we know that there's not going to be a difference. And last but certainly not least is the role of toxicity in the environment and what we get exposed to, that in turn can trigger metabolic changes that not only affect us, but are actually passing in utero into our children, into our unborn children, and leaving a legacy of poor metabolic health for generations to come. All right, let's move down into the nitty-gritty now. Let's break it down into gut health. And I feel like
I start to sound a little bit like a broken record when it comes to talking about the gut and digestion. But remember, the gut is your metabolic center. Chinese medicine, Ayurvedic medicine talk about the gut as ground zero for your health. And there's so many different reasons for that. First of all, the gut really does take your food and convert it into energy, right? But that can't happen if a couple of other things are not in the right place. So first of all, your microbiome. Do you have the right bacteria in your belly? That fundamentally determines what your body will do with food, with hormones, with inflammation, with your toxins, and so much more. We're learning more and more about the microbiome every day. Every day, if you start to Google all the different studies, it goes beyond the basics of understanding that we've got candida, which is a yeast in the gut that drives insulin and insulin resistance, or that we may have too much of a particular pathogenic strain of bacteria, to really being able to identify down to the detail. And I'm going to get detailed here, but that's why you guys listen to these webinars. For example, if you don't have enough ruminococcus, that is a bacteria in the gut that is produced when we eat enough fiber. Well, that in turn triggers a lot of issues with estrogen and estrogen dominance. So again, that gut hormone connection. Or if you have acromantia, that's associated with more obesity, or not enough fermucides, also associated with obesity. So what's living in our belly very much is determining what happens to the energy sources that we take in, and then what happens next. A second part of that gut conversation is about digestion, how you break things down. Can you move food all the way through so it delivers nutrients to where it needs to go? Now, if you're lacking digestive enzymes, for example, you're lacking amylase that breaks protein down, or lipase that breaks fat down, then we know that you're not going to break your foods down effectively. I saw a patient just yesterday, and we were looking at their stool testing, and they were having a lot of issues with protein malabsorption and fat malabsorption, leaving them both underweight, while the next patient with the same issues was more overweight. So again, your body's going to respond to these changes in chemistry in different ways depending on your metabolic thriftiness. Another part of the gut conversation is how your blood sugar is regulated. So remember, as we're digesting food and breaking food down, it is very much influencing blood sugar levels and insulin levels, which in turn determine what your body's going to do with inflammation, with metabolism in general, with weight as well. Now, if you're starting to see more visceral fat, so that's fat around your abdomen, or new fat pockets, maybe on your back or your shoulders or some of these places, you know that you're in a state of insulin resistance. Your insulin level's going up, and much of that is happening because your gut microbiome has been disrupted, or you're not breaking down things that hold insulin stable very well. That includes protein and it includes fat. And so really paying attention to the digestive process is important in metabolic health. A recent study talked too about how there's so many different gut hormones, and all of these gut hormones are influencing your metabolism. For example, there are gut hormones that are heavily influenced by your regular hormones. So for example, estrogen, right? If you become estrogen dominant, or you're storing a lot of estrogen, that in turn will influence a hormone called resistin that's actually produced by fat tissue. It'll also influence CCK, which is a gut hormone that determines the amount of bile you produce. So that's why many women, as they lose their estrogen levels, become more constipated, have more bloating, because they're not able to produce the bile that they need to move food through the body and be able to have regular bowel movement. So again, all of this highly, highly connected up together and super fascinating. The other part of the gut story too is that the gut is actually one of the biggest endocrine organs in the body. It's actually producing all these different hormones that help it to regulate weight. So we could stop the webinar right here, quite honestly, and just say, focus on the gut, make sure your gut microbiomes are in the right place, that you have the right balance of bacteria, that you're eating at regular and consistent intervals, because that allows for food digestion. If you're having things like bloating or constipation, then definitely start enzymes that have things like ox bile in it to improve the flow of food through the body, and that in turn can help with your metabolic rate or your metabolic engine. All right, let's move to the next slide. The next couple of slides, we're going to talk about hormones. And remember, hormones, again, you guys are used to the common ones: estrogen, progesterone, thyroid, insulin. You hear me talking about these all the time. But remember, your hormone balance is not just about the ones we know. Our fat actually produces hormones, our gut produces hormones. All of these hormones influence the female reproductive hormones. So I had to write these down so I didn't mess up. But the hormones in fatty tissue are actually a newer discovery, super new. And we're starting to understand that there's this whole endocrine system within fat. So it's determining things like our leptin levels, which determines how full we feel or how much food we're going to eat. Ghrelin, which is how hungry we are and whether we are or are not going to go grab more stuff. Adiponectin, which determines kind of the relationship between our hunger hormones and our full hormones. And then resistin, which is the newest hormone discovered in fat tissue that determines if we're going to be insulin resistant or not, having more or less of that metabolic thriftiness. So the more fat you have, you again are dealing with another endocrine system, just like muscle, by the way, is an endocrine system as well, also producing lots of different hormones. So again, I'm hoping you're able to see how hormones are not just estrogen, progesterone, thyroid, but they are actually coming in from the gut, from your fat tissue, from your muscle, and from so many places, and influencing what your metabolism is going to do. All right, let's move to the more predictable side, I'll call this one, which is hormones that we all know about and we test for over and over again in practice. So your thyroid, of course, influences metabolic health. And it's interesting, again, another patient story. She talked to me about how like her TSH, right, on her thyroid hormones is usually normal per conventional standards. So for example, she always, her TSH can run around a 3 or 4. But for her to be at optimal metabolic health, her TSH at a 1, she's usually 8 to 10 pounds lighter. So again, it shows like that metabolic thriftiness. Your body might need a different number to be more metabolically efficient. The thyroid is a big part of your metabolism. It is important in terms of how we're burning through food and energy and fuel, and whether you will or will not store fat. So understanding what your thyroid is doing is very important. Your estrogen level. And this is a big one, right? Because we as women in particular are very susceptible to estrogen influences and progesterone influences. So estrogen dominance is the condition of holding on to estrogen, storing estrogen, whereas estrogen depletion also leads to issues with metabolic health. We just talked about how it can directly impact the gut. So we want to, again, have a lot of these hormones are in a sweet spot. And I would take that a step further. They're in a sweet spot for you. So you do want some circulating estrogen on board, but you don't want estrone, which is the damaging kind of estrogen or the storage form of estrogen, to be higher than about 150 or 200. Otherwise, we know it's going to trigger things like insulin resistance, sluggish GI systems, brain fog, memory, all of these other things. And then, of course, the hallmarks of sort of activating cancers or autoimmune disease that we don't want. Progesterone is the same. Progesterone is very involved in metabolic health. Progesterone helps to balance estrogen. And for many women in perimenopause, the heavy periods, the frequent periods, all of that comes with being lower and lower and lower in progesterone, which then in turn raises cortisol, which then in turn raises insulin, and you're back to visceral fat and storing fat. So again, the hormone cycle is such a web and is so important to check probably every 6 months in all women. I would even say men and children need to be checking it too to understand what's happening, as our metabolic health continues to be something that we need to pay more and more attention to. All right, let's talk about one more. Let's talk about the androgens. The androgens, again, I'm seeing more and more of in women. This is what we're seeing with PCOS, where high cortisol, high stress levels, high insulin levels are leading to overproduction of DHT and overproduction of DHEA, 17-hydroxyprogesterone, and free and total testosterone, leading to things like hair loss, acne, mood changes as well. That's right. There's anxiety associated with a lot of these high androgens too. And all of that is now influencing metabolic health as well. So anything that kind of winds its way back around and influences insulin and then influences the gut is going to also influence your metabolic health. How do we manage androgens or understand androgens? Well, we've talked a lot about that kind of in our PCOS webinar that we did. But again, it comes a lot back to diet and stress management and sleep, some of the fundamentals of lifestyle that we have to stay on top of, or a lot of these hormone markers get skewed. And, when we were talking about the hormones in fatty tissue, leptin levels, things like hunger and feeling full, when that is thrown off, those are no longer reliable cues. So people that are very underweight or have suffered from eating disorders, or people that are overweight, their hunger cues and their feeling full cues are completely off. They're not able to rely on that. So those folks do much better eating on a consistent schedule, like eating every 4 hours, eating, at very clear intervals, because they can't depend on hunger and feeling full to help them regulate their intake, their energy intake. And so that in turn really impairs their metabolic health. And one more piece of that before we move on, remember when you're trying to lose weight and you continue to shrink the amount you eat eat less and less and less and less every serving, or over the course of time, you're slowly lowering your metabolic health. You have to allow the gut to do the work. So eating consistently, eating at regular intervals, and then still maintaining that 12-hour fast seems to be the best kind of general strategy for helping the gut and the other hormones to work effectively and work in the best way. All right, so moving on to nutrients. So if you are nutrient depleted, we can't convert food into the right form of energy. So that's why junk food calories are very different than healthy food calories and really impact metabolism in different ways. So if you're low in B vitamins, for example, we're going to know we have more issues with estrogen dominance, more issues with thyroid and thyroid balance, and more issues with insulin resistance. If you're low in the antioxidants, things like glutathione, CoQ10, vitamin C, we know that your liver is not able to do the job of breaking down fats, helping the insulin levels to regulate, managing glycogen, which is the primary responsibility of the liver. If your magnesium is low, again, it not only affects the gut, where you might not be able to empty completely, but it will also affect estrogen and progesterone ratios, impacting your metabolic health. And if you're not getting enough of the good fats, so the essential fats, then we also know that insulin levels become unstable and the microbiome becomes unstable, flip-flopping between bacterial overgrowth or candida, and then triggering more inflammation. So getting the right nutrients through the food that then gets converted into fuel, that then becomes a part of your metabolic story, is really important. Okay, let's move on to inflammation. I mentioned it briefly at the beginning. Remember, inflammation is the body on fire, right? So the body reacting against itself. Now, there are many signs of inflammation, but who can guess what one of the most common signs are that people don't realize is actually a sign of inflammation? That's actually fatigue. So many patients come into me and they don't have the classic, right? The joint pain or the joint swelling or skin rashes or some of these things that you commonly associate with inflammation. Instead, they've got just deep fatigue. They have chronic fatigue, or they have brain fog, or they're having some of these more cognitive type symptoms, but those are actually all symptoms of inflammation. And so when we go to check numbers, we're able to see things like a high homocysteine, a high SUD rate, a high CRP, and are able to say, wait, like your fatigue is inflammatory. And many people that are fatigued or in a state of inflammation are gaining weight, right? They're getting more visceral fat. They're getting more fat in different areas that they're not used to. And the reason for that is that chronic inflammation worsens the condition of insulin resistance and vice versa. So again, it's like a seesaw working against each other, and that in turn leads to poor metabolic health. So there's no point doing the whole calories in, calories out business or the latest workout if you are in a state of chronic inflammation. So that's why when we're trying to improve metabolic health, understanding your gut health, understanding where you stand with inflammation, and then understanding your hormone kind of balances and strengths really is an important starting point to get the metabolic piece working effectively. How do we manage inflammation? Well, often that entire discussion takes you right back to the conversation around digestion and making sure that your digestive health is where it needs to be, because almost 75% of inflammation comes from the gut. If we're not successful, then we do diet modification, supplements for inflammation, and then sometimes in more extreme situations, I'll use anti-inflammatories or things like LDN, low-dose naltrexone, to bring inflammation down, and that's where the patient actually gets some relief. Okay, let's do one more. Let's talk about toxicity. Now, there's so many studies. Every time I do one of these webinars, I kind of jump and look at the studies and try to get a sense of what's going on out there. And it's just every year I feel like there are more. Talking about endocrine disrupting chemicals. Let me translate that. That's parabens and phthalates, organophosphates. These are the things in your makeup. These are the things kind of in your body care or personal care products, in your cleaning supplies. All of these things can in turn impact, what's happening from a hormonal standpoint. All of these can create conditions of estrogen dominance. They can improve, they can actually worsen androgen resistance or high androgen levels, in turn worsening your metabolic health and making what I've been calling a dirty liver, where the liver just cannot move things through. And that in turn creates a condition where the overall metabolic rate goes down. So again, assess your chemical load, understand your chemical load. On the Dr. Taz site, remember we have that quiz for understanding what your chemical load is. Maybe take a look at that as well and try to figure out, is there an area or two where you can change to really bring your chemical load down? I would say the first is always food, bringing down the number of additives, preservatives, sugars, toxic chemicals that you can in your food. That's a big one. Maybe then turning to body care and personal care, and then maybe after that looking at what you're using within your household. So again, your toxic load is impacting your metabolic health because it's impacting your liver health, which is a big piece of sort of the metabolic equation. All right, so let's give you some actionable things you can do. If you want to understand your metabolic health more completely, well, I tried to, I could give you guys treatment plans, and we've done that before about anti-inflammatory diets, different supplements you can take. But at the end of the day, for you in this circle, I want you to be able to personalize your plan for you. So looking at the hormones, I wrote down some of the hormones that you should be checking in some sort of rhythmic fashion. So looking at thyroid, remember that's TSH, T4, T3, free T3, and the thyroid antibodies. Looking at estrogen and the estrogen metabolites, so an estrone and estradiol is really important. Progesterone and its metabolites, again, a circulating progesterone, 17-hydroxyprogesterone and pregnenolone. Looking at free and total testosterone, DHT, DHEAS, and then I would add to this probably looking at cortisol levels as well. Now, a lot of this is listed in my hormone guide that I believe is on the Dr. Taz site, so you guys can take a look at that as well. And then I think if you're really struggling with your metabolism in general, these numbers have been really helpful for my patients. What is their leptin level? Where is the fasting insulin? Where's the hemoglobin A1C, which is the average of your blood sugar over the last 3 months? Where's your fasting glucose? These are things that are super helpful too. Looking at nutrient levels like B and D, your omega-3 levels, your magnesium levels, and then again, doing a deeper dive maybe into your gut health and understanding where candida is, where fat malabsorption is, and are there foods that you are simply not digesting well. And then last but certainly not least, looking at the liver and understanding where those liver enzymes are so that you can target. The point of doing these labs is to pick an area to target, because it's hard to do all of this at once, right? And if you're not in a situation to do lab work, then really starting with gut and inflammation is where I would begin. All right, let's talk about muscle health for just a minute. We talked about fat and how it's an endocrine system, how the gut's an endocrine system, and then your muscles are an endocrine system as well. When we lose muscle mass, insulin levels become elevated. We become more insulin resistant. That's why you see a lot of really skinny people that are diabetic, or you see people as they age having more and more issues with blood sugar and blood sugar regulation. It's because they're actively losing muscle mass, and that loss of muscle mass in turn is becoming an issue through which they are storing more fat or having more issues with poor metabolism. Building muscle becomes essential, paramount after 40. I would try to add some way of building muscle at least 2 to 3 times a week. You can start with isometrics. You can start with things like Pilates or yoga or bar, some of the things that many of us love to do. But as the body acclimates to that, you have to put more load or demand to improve your metabolic rate. So that's where you do want to start lifting heavier and heavier weights and doing that, even if it's for 10 minutes, 10, 15 minutes, doing that 2 or 3 times a week. So again, remember to challenge and then to also assess. You should know your numbers, know where your body fat percentage is, know where your muscle mass is, understand where some of these things are because they in turn determine your metabolic rate and give you the bandwidth for energy and for fuel so that you have more metabolic thriftiness as the years and as the decade goes by. All right, and let's talk about, as I've kind of looked at some of this, trying to provide everybody with resources to help them start somewhere. So we have our weight loss type quiz on the Dr. Taz site. Take that quiz. That again uses this east-west approach to understanding who you are and what plan or diet might really work for you, and helping you match, your chi and your energy to this idea, of metabolic thriftiness and really what is the right place for you. The 21-day belly fix is on there as a course. I recommend that you do that if you really feel like the gut is where you're struggling. You have a lot of gut symptoms. You've got a lot of bloating, reflux, constipation, any of these type of things. Then that really might be the right place to start. And then if you don't want to do any type of program or quizzes, if you want to do just one thing, maybe try the East-West way. Try my belly fix. That actually has pre and probiotics in it. It has MCT oil to help stabilize the microbiome, glutamine. It has a lot of spirulina to clean up the liver and some grasses as well. So that might be the one thing you can do to kind of get your metabolic health on track. So I will stop there, but hopefully through this, you've understood how there are so many different pieces to metabolic health. You can't talk about metabolism as calories in, calories out. You really have to tackle each of these aspects: the gut, your hormones, your fat tissue, your muscle tissue, your overall toxic load, looking also kind of at inflammation. And that, when you tackle all of that, that's when you can really get the right metabolic equation. And that's when diets work. That's when everything starts to work and you start to see yourself really having success with overall metabolism.